Hello, everyone. My name is Natisha, and I will be your moderator this evening. Welcome to this live interactive event with Congresswoman Bonnie Watson Coleman. If you have a question during our program for our panel this evening, please press *3 to enter the queue to speak with a conference specialist. They will take down your name and where you are calling in from. The next time you hear your name, you will be live on the call and you will be able to ask your question directly. If you are streaming the event on our website, you can simply type your name and question below the streaming player. We will also have some polls this evening, and we want to hear from you, so please make sure to participate in those as well by using the phone keypad and pressing the corresponding number when those are given. I would now like to turn it over to Congresswoman Bonnie Watson Coleman to open up the discussion tonight. Congresswoman?
Thank you, Natisha, and hello to everyone. I am excited about tonight's Tele-Townhall. I want to welcome you all. I have this discussion about the COVID-19 vaccine. We'll be joined this evening by New Jersey Health Commissioner Judy Persichilli, Dr. Kemi, Alli, the Executive Director of the Henry J. Austin Health Center in Trenton, and Medina, Forrester, the Executive Director of the New Jersey Office of Minority and Multicultural Health. They'll be providing us with an update on the COVID-19 vaccine rollout in New Jersey. We'll also have our moderator, Natisha, who's going to be helping with the technical side of things. This is also an opportunity for us to answer questions that you may have. Members of my staff will be taking your calls so that you can ask questions to our panel. Commissioner Persichilli, why don't we start with you? Can you please give us an update on what New Jersey looks like in regards to COVID cases and where we are at with the rollout of the vaccine?
Thank you so much, Congresswoman, and thank you for hosting this town hall and inviting me to participate. The department appreciates all your efforts to get accurate information about vaccination out to your constituents. Dr. Kemi Alli, thank you for your work to care for and now provide COVID-19 vaccinations to the Trenton community. Today, here at the department, I'm joined by the department's Director of Minority and Multicultural Health, Medina Forrester, who will be leading the department's efforts to offer equitable access to the COVID-19 vaccination. As I sit here today, I'm reporting we had our first case in New Jersey on March 4th of last year. So we are nearing our first year anniversary. And today, we are reporting a total of 778,963 positive cases in New Jersey. Additionally, we have experienced almost 21,000 deaths. And this virus has had a disproportionate impact on communities of color and our older citizens. However, on a brighter side, we're also reporting that we have administered 1,821,510 doses of vaccine. The leadership team at the department focuses every day on bringing vaccine to underserved communities because we recognize that the same longstanding inequities that have contributed to health disparities affecting racial and ethnic groups have also put them at risk for COVID-19. Listen carefully to these statistics. Latinx and Black populations in New Jersey have mortality rates that are nearly double those of white non-Hispanic populations. The young Hispanic males are nearly 3 times more likely to die from this disease than their white counterparts. The department is using a data-driven process to ensure it is reaching communities who have experienced the greatest burden of COVID-19 and who also face the most barriers to access. We have a vulnerable populations plan that involves partnering with community and religious leaders and FEMA to operate pop-up sites in places of worship, senior centers, community centers, and local health agencies. Additionally, community health workers will be deployed in communities of color to provide education help with registration, and access to vaccination sites. We recognize that there is a level of mistrust and resistance to COVID-19 vaccine across communities of color due to long-standing inequities in the healthcare system, and the department is working to build confidence in the vaccine. We are working with health professionals, faith and community leaders that represent communities of color to dispel myths and share facts about the vaccine. The department wants the public to understand that the COVID-19 vaccines are held to the same safety standards as all vaccines. The COVID-19 vaccines were tested in large clinical trials to make sure they meet all of the safety standards. Many people were recruited to participate in these trials to see how the vaccines offer protection to people of different ages, races, and ethnicities, as well as those with different medical conditions. The vaccine data is reviewed by independent committees composed of scientific and clinical experts before it is approved. And then the FDA, Food and Drug Administration, and the CDC, Centers for Disease Control, monitor vaccine safety and side effects once the vaccines are in use. So we're thankful to have leaders like Congresswoman Watson-Coleman, who was vaccinated and is using her platform to talk about why it is essential for individuals to get vaccinated. Vaccination is one of the most important steps we can take to protect ourselves, our families, our loved ones, and our communities. When we reach our goal of vaccinating 70% of the adult eligible population in New Jersey, hopefully we will have community protection, or you may call it herd immunity, to stop this virus from spreading. We are making progress vaccinating our residents. But to get to that goal, educational information sessions like this one are vital to help share the facts about the vaccine, but also to answer any questions and address concerns that you may have so that you will feel comfortable getting vaccinated. So once again, thank you to Congresswoman for hosting this roundtable and inviting the department to be part of this event. I'll turn it over to you.
Thank you, Commissioner. Thanks for the work that you all are doing, and thanks for being so compelling and sharing with people how just important it is to get vaccinated. And thank you all for having vaccinated a million people in the state of New Jersey thus far. That is a really good job. I know we've got a long ways to go, but having these information sessions hopefully makes it easier for people to have trust in it and to be willing to become vaccinated and to learn how to get their vaccinations. Would you just share with us before you leave, Commissioner, what is the best way for people to sign up to get the vaccine?
Thanks for that question, Congresswoman. Individuals may register with the New Jersey Vaccine Scheduling System, NJVSS, available at covid.nj.gov/vaccine, VACCINE, and you will be notified when appointments are available. We also have a call center available at 855-568-0545. The vaccine call center can also help register individuals into the vaccine scheduling system. It is operational from 8 a.m. to 8 p.m., 7 days a week. There are almost 1,000 live agents, and many of them bilingual, that will be able to help you register and answer your questions about the vaccine. Now, there are some sites, such as those affiliated with hospitals and some of them affiliated with our county health departments, who do their own registration. You can find a link to those sites at covid19.nj.gov/vaccine.
Let me ask you just one question, because we've got a lot of questions about not being able get their appointments or to make their appointments. When you sign up or when you call in, do you get directed to locations close to where you live or work, or the areas in which you're interested in, from where you're interested in getting your vaccination?
Sure. Now, there's two things that are happening here. If you go to the covid19.nja.gov/vaccine, you will be directed to every site in every county in New Jersey, and there'll be a link to those sites, and you can hit the link and register directly. That's the easy part. The more difficult part is we still do not have enough vaccine to meet the demand. So you will get a message that as soon as an appointment opens up, you will be put in the queue to make your appointment. Unfortunately, because we do not have enough vaccine to meet the demand, the wait may be very long, and it is frustrating. However, since the Biden administration, we have seen our vaccine allotment increase slowly over the weeks. And we expect tomorrow for J&J to get authorized to release their vaccine, so we will be getting more vaccines in the next couple of weeks. And hopefully, by the end of March, mid-April, we will have enough vaccines for anyone who wants to get vaccinated in New Jersey. But it will take some time.
Two quick questions for you. Is it true that our dosages were stranded in Texas because of the storm? And when are we expecting to get them? Do you know?
That's a great question, too. There were doses stranded in the Midwest and in Kentucky. And last week during the storm, all of our doses were abandoned. They were stuck. But we got double doses this week because of that. So all of our, we have over 300 sites in New Jersey where you can get vaccinated, and all of them were working overtime this week to use up as many doses as they received because they had to reschedule people, and they had to double up on their staffing and their time to be able to vaccinate people. So that's being cleared up this week, and we will go back into a steady state next week.
I'm going to ask you to repeat that number that one should call in order to sign up. And I'm going to ask you also, do you have any idea when you expect those in Category IC to be eligible?
The first, here's the number, 855-568-0545. So that's 855-568-0545. I expect, Congresswoman, that probably next week we will be calling up, making eligible a large number of the individuals in 1B, and that will include food service workers. It will include, I don't have the list in front of me, but I'm going to try to pull it up. Does
it include teachers?
It will include teachers and support staff and social service individuals. It will be a pretty exhaustive list. Unfortunately, we won't have enough vaccine for everyone, but individuals will be eligible in a couple of weeks. So they can at least register. And I'm still looking. I'm sorry, Congresswoman, I'm still looking for the list. They will be able to register and get in line.
Okay, well, we can have access to the list, and we can certainly share it on our Facebook page if that works for you, Commissioner.
That'd be fine. It's probably going to be expanded next week. I found it. It will include educators and staff, child care workers, public and local transportation, transit, food production, agriculture, food distribution, elder care and support, warehousing and logistics, social services support, and elections personnel. I expect that to be operational next week, sometime next week.
That is indeed good news. So those in Category 1C still have a bit of a wait.
1C will wait.
Yeah. Let me turn this over to the moderator now.
Great, thank you. Yes, before we continue on with our next guest, if you would like to sign up for Congresswoman Bonnie Watson Coleman's newsletter, go ahead and please press 1 on your phone keypad now. So go ahead and press 1 if you would like to sign up for Congresswoman Bonnie Watson Coleman's newsletter. Okay, back to you, Congresswoman.
Thank you. I hope you sign up because I want to stay connected. We've got so much information that we need to be sharing with you all in a real-time fashion, and this is one way that I'll be able to communicate with you. I want to thank the Commissioner for giving us the presentation that she did and for the hard work that she and her office continue to do. I am pleased to say that we also have Dr. Alli, who is the Executive Director of the Henry J. Austin Healthcare Center. And Dr. Alli, I'm wondering if you could tell us more about how this rollout has been handled at the center. I've heard good things, but I want you to tell us. And what can people expect when they arrive to get their vaccine? And do they reach out to your center to sign up as well?
Yes, thank you. Thank you so much, Congresswoman, for the invitation. And I, too, want to echo the Commissioner's words about just thanking you and all the work that you've been doing in terms of making sure that our community has the information so they can really make informed decisions that's best for their family, their friends, and their loved ones. This is so important, events like this. So thank you again so much for this. And I also want to thank the Commissioner and her team. They have been absolutely amazing partners in this work. And, you know, they often don't get thank yous, but they have just been doing an amazing job. This is so challenging, so difficult. And it's just been great to work with their team. They really have some hard-working, dedicated individuals at the Department of Health under the Commissioner. So thank you so, so much. So, yes, the rollout of the vaccine and what people can expect. They will drive up. Most centers are drive up. So Henry J. Austin has a drive up center. You will make an appointment first, and I'll come back to how we make the appointments. But once you've made your appointment, you drive up during your time. Someone will come out to you as you park your car in the parking lot. They will get your information. They will also give you information if the individual has not printed out forms and signed their consents and paperwork and things like that. You will be given those when you drive up. You'll fill them out. Then you will be called, so we'll get your number, and you will be called when it's time for you to come into the building and receive your vaccine. You will then do that, and then you will wait either the 15 minutes or the 30 minutes after you've received your vaccine to make sure all is well. You will be given a postcard reminder that tells the date of your next appointment, and at Henry J. Austin, we do give you a date for your next appointment. You will also be given information about what to expect now that you've received your vaccine. What are some of the local reactions? What are some of the systemic reactions that might happen that are pretty common? So you might get soreness at the injection site. You might have fatigue. You might get a fever, sometimes a headache. Those are common reactions that happen after you get the vaccine. So you'll get information on that, and then you can leave. And so, as you said, Congresswoman, we've had reports that the system has worked really well. It's been efficient, effective. We've been able to give almost 150 vaccines a day, and it's been working very well in that regard. In making the appointment, we are using the NJVSS system that the Commissioner described to make our appointments. But as we go forward, we may be changing that. Our website has all the information when and if and when we do change. We might become one of those sites that's independent in order to make appointments and schedule them as we go forward. But right now, we are using the NJVSS system, and if you go to our website, that's what it will say. It'll say go to the state system, sign up, and we also give the same number that the commissioner mentioned if people have questions about how to register on the NJVSS system.
Thank you, Dr. Alli. I appreciate that. And as I said, I've only heard good things about experiences when one has received their vaccination at the center. I've received a number of calls from people in the 12th district saying that they've had trouble getting a vaccine. So we've got a poll question for everyone now. What issues have you run into when trying to sign up for the vaccine? What issues have you run into when you've tried to sign up for the vaccine? Press 1 if you're not yet among the people in Category 1A or 1B of the vaccine rollout. Press 2 if you're eligible but haven't been able to find a location with vaccines available. Press 3 if you've had trouble signing up on the website. Again, press 1 if you're not yet among the people in Phase 1A or 1B of the vaccine rollout. Press 2 if you are eligible but haven't been able to find a location with the vaccines available. Press 3 if you've had trouble signing up on the website.
Great. And as we wait for those results to come in, just a reminder, if you would like to ask a question of our panel, please dial *3 to connect with a conference specialist. A member of the staff will collect your questions, and we will answer as many questions as we can during this live event. Again, you can press *3 on your phone keypad at any time to get in the queue to ask a question. And if you are participating online, you can submit your question below the live streaming player.
Thank you.
So now,
thank you, Natisha.
Yeah, you're welcome.
So while we're getting some of these calls in, I'd like to turn to Amanda Medina Forrester, who's been introduced to us already as the director of the Jersey Office of Minority and Multicultural Health. Amanda, a number of people are concerned about getting the vaccine. Can you take a moment to address some of their fears?
Yeah, hi, Dr. Congresswoman Watson Coleman. I really appreciate us being here and just having a conversation. I think these conversations, this dialogue is so incredibly important for everybody to know more about the vaccine. And here at the Department of Health, just like Dr. Alli is doing on the ground, I think a lot of our boots on the ground is what we need. So these are the perfect conversations to have. So the COVID vaccines are incredibly important. They do two things. They protect ourselves, and then they protect the ones we love, and also protect our communities. So they are safe, and I could give you a couple of things about why they're safe. Both vaccines are 94% effective in protecting against the COVID-19 after getting the 2 doses. The vaccine does not contain any virus and cannot give you COVID-19. They do not alter your DNA and do not cause any infertility. So before you get the vaccine, please talk to your doctor. If you have any severe allergies of the ingredients in the vaccine, if you had any severe allergic reactions to the vaccine from past vaccines, if you're even breastfeeding or you plan to become pregnant. So these are just conversations you need to have with your health care, but they are safe. They are 94% effective. And let me tell you a little bit about how they were developed. It took many, many years for these to be developed. The research has been similar to all virus and vaccine technology. So again, it wasn't quick. It's been a process for the virus and the vaccine technology. The COVID-19 vaccine has been researched in phases and overlapped, and manufactured efforts began early, so we could have the vaccines available as soon as it was authorized to do so. So again, through the pandemic times, we looked at phases 1, 2, and 3, and then of course, some other times too, we did other manufacturing, some other phases within the manufacturing timeline. But again, they have been researched for many, many years before, and this is something we need to convey to our consumers. You definitely, for the Pfizer Moderna, you do need both doses of the vaccine for maximum protection. Your second dose should be the same brand as your first dose. The vaccine doses are spaced out 3 or 4 weeks apart, depending on the vaccine, and this is who your vaccinator or your provider will let you know. And of course, after the vaccination, continue to wear a mask, continue to have physical distancing. We still need to protect ourselves from COVID-19, and sometimes, the best way to do it is through all types of mitigation prevention efforts. So some vaccine types will not require the 2 doses. Just as our commissioner mentioned before, there's going to be some future vaccines, such as the Johnson & Johnson vaccine, that will only require 1 dose. And you should not wait for a particular type of vaccine. The one thing that we do tell our residents is that don't wait. Get vaccinated when you can, unless you're authorized by a healthcare provider to do something different, but definitely don't wait. The vaccines do a few big things for your body. They protect us from against the germs, making viruses and bacteria that make us sick. The vaccines also help our immune system. They help fight off these germs and teaching our body how to make our own antibodies. So all vaccines are incredibly helpful for the community, for a healthy community. I want to just talk briefly about some side effects, so everybody to know about some side effects of the COVID-19 vaccine. The common ones are pain at the injection site. So that's like any vaccine. There is a little bit of muscle pain, fever, chills, tiredness, and a headache. Some side effects too. These side effects are normal and should usually go away in a few days. But please call your doctor, just like Dr. Alli and her very, very trusted staff and herself. Please call your doctor if you feel that you have any other severe side effects. If you're seeing any redness or tenderness where you got the shot and it increases after 24 hours, if you're just worried about the side effects that you're seeing, it doesn't seem to go away, please call your provider. I think it's so important that we have these communications, this dialogue with the provider. And then, of course, make sure you still continue to wear a mask and physical distancing. Always stay 6 feet apart. Continue to avoid crowds. Continue to avoid sick people. Wash your hands often. And please get vaccinated as soon as you become eligible and as soon as you can get the vaccine. So that's a snippet of what the vaccine is about, what it does to your body, and then how you can protect yourself. But thanks again, Congresswoman, for allowing us to be here and being at this space to educate as many people as we can.
Well, thank you so much for the information that you shared. I want to confirm with you the categories of people who are eligible right now are 1A and 1B?
Yes, correct, Congresswoman.
Yeah.
So right now it's 1A.
And then next week it'll be 1B.
So there's parts of 1B. So the 1A is considered healthcare workers, paid, unpaid.
Right.
And then, of course, part of the 1B is frontline first responders and 65 and older, long-term care facility and congregate setting residents. And then ages 16 to 64 that have at least one chronic medical condition that poses that high risk for severe COVID-19.
I just think that we need to have as much information as possible. And as a member of the Homeland Security Committee and the Appropriations Committee, we were informed by Dr. Fauci and others that not only has the vaccine gone through the rigorous process needed to ensure that it is safe and its efficacy is as being reported, but it was also tested on a diversity of people, of different races, ethnicities, ages, and other conditions. So I think that our communities need to know that. I received my first dose of vaccine on December the 29th, And even while I did get infected with the COVID before I could take my second dose, it likely contributed to the more mild symptoms that I had. I know that the vaccine is safe, and I implore everyone, I beg everyone, when you become eligible, please sign up and please get vaccinated. I'm waiting for my second shot. I have to wait an additional number of days or months, actually, because I was infected, but I am so looking forward to that second shot. So I'd like to turn it over to the moderator who wants to discuss a final poll that we have.
Yeah, well, let's go over the results of our last poll. What issues have you run into when trying to sign up for the vaccine? 31% said they are not yet among people in phases 1A or 1B. 57% said they are eligible but have not been able to find a location with vaccines, and 13% said they have had trouble signing up on the website. So now we want to hear from everybody on our last and the final poll question. So again, if you're on the phone, you can vote by pressing the corresponding number on your keypad. If you're online, you can vote by selecting your response below the streaming player. But our question is, do you plan to receive the vaccine when it becomes available to you? Press 1 for yes, press 2 for no. Again, do you plan to receive the vaccine when it becomes available to you? Press 1 for yes and press 2 for no. So with that being said, we are in the question and answer portion of our evening, and we're going to go live to the phones, and we have Roxanne. Roxanne, you are live. Go ahead and ask your question, please. Roxanne, are you with us?
Yeah, I am, but I had given my question or what I was asking to the guy who answered the phone, who came back on the phone. I didn't know I was actually going to.
Yes, ma'am, you are live with us, so go ahead and ask your question. Don't be shy.
It wasn't actually a question. The issue is a lot of people are under the impression that once they get this COVID vaccine that, they're not going to get COVID. Like they're okay, they're free, they can do whatever. And I just wanted to know what information is being given to individuals when they get this vaccine. Like, are they told to still, not that you should have to be told to wash your hands, but, wash your hands, kind of stay, still stay socially distant? Like, what information is being given to people who are getting the vaccine?
So, Dr. Alli, I think that I'd like to give you that question. I know that the commissioner spoke to trying to accomplish community protection at 70%. And I know that she said we still need to mask and wash our hands and maintain our distance, but perhaps you could be more enlightening on this question.
Yes. And so I know at Henry J. Austin, thank you for this question, and it's a very good one. So, yes, I know at Henry J. Austin we give handouts, and I believe most centers do that, saying just what the caller, Roxanne, what you said. We tell individuals once they've been given the vaccine, yes, you must still wear a mask, you must still do appropriate physical distance, wash your hands, don't aggregate in large numbers, and stay in well-ventilated areas. All those things are really, really important for two very good reasons. Number one, as the Congresswoman just stated, her experience, you can get COVID after the first vaccine or the second vaccine, because remember, it takes several weeks to build that immunity. These are 2 shots required. So in between the first and the second one, you were definitely still susceptible. So again, masking, social distancing, washing your hands. And then even after the second dose, it still takes several weeks to build that immunity. So it continues to be important. And then lastly, there's a small group of individuals that can still be susceptible. So again, being very, very careful and doing all those things even after you've received your first dose and your second dose is critically important.
Great, thank you.
Thank you, Dr. Alli.
Yeah, we're going to stick with the phone. And we are going to go to Maxine from Trenton. Maxine, you're live. Go ahead and ask your question, please.
Yes, ma'am. A lot of my questions have been answered. Hello, Congresswoman Bonnie Watson.
Hi there.
Hi. What I want to say is this here. Now, I got my first vaccine on the 23rd. My question is this. A lot of people that I know is not getting the vaccine. My concern is if a lot of people are not getting the vaccine and a lot of people are getting the vaccine, say it's 50-50, what's going to happen with the ones of us who are getting it and then we have so many who are not getting it? How is this thing going to work out in the long run? That's my concern.
Yeah. Thank you for that question. I'm going to turn that over to Dr. Alli also. But this is one of the reasons that we're having this conference, and while we will have more, because we think it's really important to educate our community on the safety and security of getting the vaccine and the need to get it for community protection as well as individual protection. But I want to turn that over to Dr. Alli.
Yeah, another very good question. So the CDC it's an excellent website. And on the CDC, it talks about 2 different ways we can get herd immunity. And herd immunity, when you have that, is when your community is really protected and we can hopefully get back to life somewhat as normal. So 2 different ways to get to that herd immunity. One is to vaccinate, and we've heard the numbers, vaccinating anywhere from 70% to 80% of our population of adults is what will be required. The other way to get herd immunity is as people get infected and they get better. So if fewer people get the vaccine, it then means it takes a lot longer to get to that herd immunity. So if you go to the CDC website, it gives you some really good projections to say what happens if all the individuals, as we're saying, 70% or 80% don't get vaccinated. And it pushes the months out from June to July to August until we get to that herd immunity, as opposed to if many people got vaccinated earlier on, we could achieve that herd immunity by May or early June. So if more people don't take it, it pushes out the length of time it takes us to go back kind of to normal.
Amanda, if you ever want to just jump in to one of these questions, please feel free to do so.
Thank you. I think Dr. Alli, I just love the way you answer it, and it's perfect. It's just perfectly done. So thank you. I'll definitely jump in if I need to. Thanks.
Thank you.
Great, thank you. And speaking of herd immunity and the vaccine, we do have our last poll results in. Do you plan to receive the vaccine when it becomes available to you? 93% said yes, 7% said no. So going on to our next caller, we do have Lori on the phone. Lori, you are live. Go ahead and ask your question.
Yes, hi. I, too, am from Trenton, like Maxine, and mine is kind of a follow-up question. In the state of New Jersey, do we have a program or some type of initiative to start going out into the communities and do, like, mobile vaccination clinics or outreach operations so that we can involve the more vulnerable populations, because, again, the technology piece, it seems easy to a lot of us, but that having to get online or even to make numerous phone calls is not always easy for a lot of people. So, in other words, are we engaging our community leaders to, boots on the ground to get this initiative going?
Thank you. I think that's a great question for Amanda.
Yeah, thank you. That is a great question. That's something that we have been talking to a lot of our partners about. So just talk a little bit about the actual vaccines. Right now with the vaccines, they're so motion sensitive. Just having them in a mobile unit would be hard. They have to be ultra cold. And Dr. Alli, you probably know a lot more about the vaccine, the storage, handling, the transport. They're not easy. However,
I do understand that. But Philadelphia did start such an initiative, and I think it was rather successful last week.
Yeah, so we're working on that too. We're building pop-up sites, pop-up clinics. And so it's not really a mobile, but it's more pop-up where we go to where the people are. We have 10, where we're launching a full set of 10 pop-up satellite just to get best practices. And again, this is just a pilot test, but our goal is to roll out mobile units when we get the J&J, because the J&J will be more transportable. It'll be more feasible. And then, of course, with the pop-ups, definitely the Moderna would be using. But right now, we do have 10 pilots that have been rolled out throughout New Jersey. One's actually in Trenton right now, and we're doing a lot of lessons learned. And then ideally, as we get more vaccines, we want to have a lot more of these pop-up clinics or pop-up sites, and then, of course, engaging our federally qualified health centers such as Henry J. Austin and others that have even the mobile clinics to start rolling those out. So, yes, we definitely have a plan. I think as more vaccines come around, we have more mobility, more feasibility to make this happen. But, yes, I completely agree. Let's go where our people are and not assume they're going to come to us. I completely agree.
I'd like to interject a question as a privilege of the host here. How do we plan on addressing the homeless population that's neither going to be able to sign up nor have access to the kinds of information that they need to supply before getting their vaccines? What are we thinking about in terms of dealing with those populations?
That's a great question, Congresswoman. We have a plan for our people experiencing homelessness. So there's actually a really, really strong coalitions out there in New Jersey who have already been thinking about this for people experiencing homelessness and how to actually get the vaccine to them, give them the access. The federally qualified health centers have been pivotal. They are pillars of equity, and I think we will turn to them to guide us on how to get to the shelters, and we give the allocation to the FQHCs or to our other providers to work closely with the shelters to ensure that there is access. And again, we might not get 100%. A lot of people might not want it, but that's okay. I think we may need to make sure that they have that access. So there definitely is a plan in place that's going to be rolled out very, very soon with people experiencing
Thank you, Amanda. Thank you. Back to the moderator.
Great, thank you. Yes, thank you. We are going to go back to the phones, and we have Donna on the line. Donna, you are live. Go ahead and ask your question, please.
Yes, good evening. I want to say the question that the Congresswoman had just asked was one of my questions, so thank you for that. But I also would like to know, what about our seniors and people that doesn't have knowledge of going online? Because the computer can be very difficult for some of the seniors. What are we going to do to help them?
A good question, Amanda. Do you want to take a stab at that?
Sure. So we are seeing that digital divide. I mean, using the computer is incredibly such a barrier for many of our seniors. Even for me, sometimes it is a barrier. And I think the one thing that we keep talking about is specific campaigns for seniors, doing outbound calls. So we started doing this through our call center. We have over 2,000 call center agents that could do outbound calls and help schedule seniors through that process. I think right now, because of the scarcity of the vaccine, the pilot is small, the program is small, but as soon as we get more vaccines, this campaign is going to roll out really fast and just explode, because we have so many of our seniors, especially those 75 and up, that need the vaccine. And so we do have the callers waiting to go. They're ready to make calls, ready to schedule, ready to get them into a pod, points of dispensing. So that's one way. We're also working with our Department of Human Services, DHS, and since they have a lot of leverage, they have a lot of the stakeholders for seniors, especially homebound. We'll be working closely with them to ensure that we are getting to that population ASAP as soon as we get more vaccines. So there are definitely many plans going to be rolled out by next week to ensure that we get more of these vulnerable populations registered and vaccinated.
Great. Thank you so much for that question, Donna. Next up, we have Elizabeth from Somerset. Elizabeth, you are live. Go ahead and ask your question, please.
Thank you. First of all, my compliments to everyone who's been working so hard to get this all done, and you've done it in a rather crunched time frame. My concerns are two. First of all, the sites that were built and that exist, I'm not sure they've been run through any kind of accessibility software to see that those people, especially those who are blind or deaf-blind, may be using accessibility software. Those sites may not, and I can tell you from experience, are not particularly accessible or compatible with the accessibility technology that's out there today. My second concern kind of follows on the first and was sort of touched on. All you hear about is, well, you drive up to the site. New Jersey and public transportation being fairly mutually exclusive terms, how do you get there from here if you don't drive?
Wow. Those are both good questions. So I was on the phone with FEMA today, and their whole civil rights unit is looking very closely at state sites and accessibility for people with various disabilities. And I think that even I'm going to give it up to Amanda to talk specifically about what their plan is, but we know that's been an issue. And so is the issue of access to transportation. And I think that as more vaccine becomes available, and I have all the confidence in the world in Joe Biden doing what he says he's going to do and our governor doing what he said he's going to do, we will have sites in places that are otherwise hard to get to with public transportation. And I think we need the doses. We have the willingness and we will have the capacity, but we need the doses. But for Amanda, you might want to speak to that from a policy perspective.
Yeah, thank you. That is a great question. For the accessibility technology piece, that's a great point. That's something that we need to look into more, honestly. I don't have the visibility of each of the points of dispensing to ensure that there is accessibility. I know with our mega sites, we are working closely with the Department of Human Services to provide ADA and other types of accessibility technology within those mega sites, but I don't have the visibility on the other ones, but I will definitely find out for you. In regards to the driving to the site, I think that's something that we talk about a lot on where the pods should be based on walkability. So one factor that we have looked at across the state is there a pod located in a walkable community where it's less than 15 minutes? Because sometimes it's, like you said, Jersey is not as great with public transportation, so we need to make sure that we go where the people are, where they live. So this includes the pop-up clinics that I mentioned briefly, and of course mobile units, and then of course activating other points of dispensing. So maybe there's a clinic in the neighborhood that is not activated because it needs some resources. So that's something that we're looking at the Department of Health on how do we turn that on? How do we activate that points of dispensing? Another one is giving more allocation to our current pods, such as our FQHCs. For Dr. Alli and her team, they did a phenomenal job phenomenal on vaccinating, and they could do more if they want to, and so that's something that we're talking about is, do you like more allocation? If you do, great. We would love to give you more allocation to serve your communities. So these are the conversations we're having in regards to the driving, the lack of transportation, and no vehicle access. Thank you.
And if I can add too, we also have the program that started with the CVS and the Rite Aids throughout the state, and many of them are located on bus routes. Now, they have the same issues of everywhere else in terms of the shortages, but the idea, as has been said, that once there's more and more vaccine, these locations all throughout the state will be the same CVS and Rite Aids we go to all the time. And as I said, many of them are on bus routes and close to public transportation. And as was mentioned, places like Henry J. Austin, we are really thinking about this issue hard. And so, for example, we started with Uber Health. We have an Uber Health account, so we can actually provide that transportation for individuals to get to our health center and then leave after they're done. And I know many health centers across the state are doing similar things, because this is the work we do all the time, working with those vulnerable populations and understanding the barriers that they face, in particular transportation.
Great. Thank you, everybody. We are coming to the end of our evening, but we do have a couple of more questions that we are going to get to. Our next one is from William. William, you're live. Go ahead and ask your question, please.
Yes, my question is that I heard that you had 2 vaccines that's in New Jersey, and actually how many different vaccines are there in the state of New Jersey? How can I find out exactly what's in the vaccine itself, or on all of the vaccines that you're going to be given? Also, is there any knockoff vaccines out there that's there? Mm-hmm. And also, the last question is, when you take the first shot, do you take another COVID test before you get the second shot? Dr.
Alli, do you want to tackle that? Great
question.
Yes, a great series of questions.
Yes. So let me try and remember them all. So start with the first one. No, you do not get tested after you get the first dose. It's not recommended. So you get your first one, you wait, and then you get your second one, either 3 weeks for the Pfizer or 4 weeks for the Moderna. And then the other question was about knockoff. Well, this is where I think going to the state's website that was described is really important, because you do want to go to one of those listed sites to get your vaccine. That's what I would recommend, going to one of the listed sites to get your vaccine that's on the New Jersey state website. And then the first question, I believe, started with, how many vaccines are there in New Jersey? Well, in the United States, there are 2 types of vaccines right now, only 2, one from Pfizer and one from Moderna. And what was just, I think, hot off the press today was the Johnson & Johnson product that will be probably coming in the a week or 2 to follow. So there'll potentially be 3, but there will be others. The 4th one that's in development, it's in its phase 3 trials, I believe, also is one from AstraZeneca. And by the time we get to summer, there may be others. So right now in New Jersey, there are 2. One that's probably soon to follow, as was described, the Johnson & Johnson, and probably several weeks after that, we'll have the AstraZeneca, so potentially being 4 by the time we get into April and May. But right now, there are 2, soon to be 3.
Great, thank
Moderator?
you. Yes, thank you. Okay, here's our last question for the evening. We are going to go to George. George, you're live. Go ahead and ask your question, please.
Hi, this is Janet and George from Trenton, New Jersey. And our question is, if you test positive, say, a couple of months ago, and you don't feel sick, can you still get the vaccine?
Dr. Alli, do you want to handle that in terms of the time frame?
Yes. So thank you. And yes, the answer is yes, you should still get the vaccine and you can get the vaccine. You do have to, if you've had COVID, you do have to wait 90 days after you've had your symptoms. But then you should, it is recommended by the CDC that you do go and get your vaccine.
Great. Thank you, everyone who's called in tonight for the great questions. If we were not able to get to your questions tonight, know that our staffers have recorded your questions and will be reaching out to you to get you an answer as soon as possible. And now back to Congresswoman Watson-Coleman for closing remarks.
Well, thank you. It's really been a blessing for me to be a part of this outreach to our community, and I hope that you found the answers to some of the questions that you were looking for. Perhaps we weren't able to get to your question, but I tell you, you can either leave a voicemail or you can go to my website at WatsonColeman, one word, .house.gov/contact, or you can call our office at 609-883-0026. And you can leave your information or you can ask your question and someone will get back to you. And you can also become part of our newsletter recipients so that we can keep in touch with one another. We're planning on hosting more of these events in the future to keep you informed on what we're working on and other important updates. But in the meantime, stay blessed, stay healthy. Remember to keep wearing your mask, keep social distancing, and wash your hands often. Thank you again. Have a great evening. To the moderator, thank you very much. And to my guests, I am so grateful to have shared this time with you. Thank you for sharing your wisdom, knowledge, and information.
Thank you so much for having us.
Yes, thank you.